me to ask for something for you?
I will. I don't
Very
mind.
nice.
I'll do it.
I don't know that we met. I'm Suzie. Hey, good to meet you.
I'm with Biomax. Who are you here with?
Oh, I'm the medical director on the west coast of Florida, so southwest and central Florida, so Tampa, Sarasota, that area.
Cool. Oh, I'm with Biomax. We're a tissue procurement service, so we're just here to make connections and see who we can meet.
Okay.
You enjoying yourself this far?
Yes. Yeah.
Pretty cool, right? Yeah. We were at the, there was one in Miami in October. We attended that one. That one was massive. Did you go to that one?
With the medical director meeting? Oh, yeah, I was there. Yes. Yeah, the NMC.
Yes, that one is.
Yes. Yeah.
How's your night going so far?
Good.
Pretty chill?
Where are you based in Florida?
No, we're based out of California.
Oh.
But the thing is like everyone in California is kind of already partnered up with the service. So we've kind of had to expand a little bit.
Okay. So what tissue procurement means what?
Well, basically we procure fetal tissue. Why don't you go on ahead? Can I get 2 Heinekens? So no, just fetal tissue procurement and to provide the tissues to research for medical research. So we've been doing a lot of that. We've also been doing a lot of adipose. We're still pretty new.
Okay.
So mainly we've been doing a lot of adipose tissue. But we're here to make the connections with a lot of the providers.
So it's good you're here because we have patients who ask about it in our health centers. Yeah, and we don't do it, but I think that our patients might actually be interested in it. So
trading spots. Thank you, sir.
Enjoy.
Thank you, miss. So yeah, no, definitely. It's really like a silver lining in everything that goes on. You know what I mean?
I mean, our patients, I think, like some of them would be really glad to do. So how does it work?
Well, we're definitely, there's only like a couple like things that to qualify. So we're looking for later end gestations.
Okay.
Like typically like 16 up. And just free the toxin. And have you worked with the tissue procurement service before?
No.
Oh, totally.
And our affiliate goes to 16 weeks, so we're not quite to the point.
Here, come here. Do you have a minute? I'll introduce you to my boss.
Yeah.
I'm still in school and stuff like that.
Okay, so you're just learning.
I just work here, as I say. I like to say that. I just work here.
Okay.
But here, I'll introduce you to my boss. I'm actually a tech. I go in and collect the samples myself.
We're very interested.
There you go, boss. So, now we're just really interested in reaching out with the different providers. Just trying to make the connection. So you guys said you guys go to 16 up?
We're up to 16 right now. But that said, we'll probably go further.
Yeah.
So
what's your volume like?
Probably not high enough for you guys. So that's the thing. I mean, I think our second try volume, you know who you should talk to though, is the Orlando medical director. So we're about to
his name is like
her name.
Oh, her name. I'm sorry.
Currently, but so our affiliate is about to merge with their affiliate, probably. So we'll see. But we're in a management contract with them. But they go up to 22.6. And they have decent volume. I'll connect you with her because that would be really good. Because I think our patients patients ask about it, and I think they would be amenable to it. So
well, in my experience, so what we do, we operate drop ship.
Okay.
So that makes it like I said, we had to kind of cast our gaze a little further than LA, and then so what we do is we send a tech out, usually myself or Brianna, and we kind of float in the clinic. We help out any way we can, consenting.
Okay.
And in my experience talking to them, it's like we do get those questions. They're just like, well, actually, I was wondering about that. Like, how can I? And it just comes to the little good thing out of this,
Yes. Yeah.
And so, I don't know, it's a cool thing. Hey, Robert, I have somebody to introduce you to. This is Robert Sarkis.
Hey, Robert.
What is Suzie?
I'm with Southwest and Central Florida, which is the west coast of Florida. But Adrian.
Do you work with the guy with the ponytail? That's who I thought it was.
He's the other guy. So he's on the other side of Florida.
Okay.
But so our affiliate is the west coast of Florida. But we're about to, there's probably going to be 2 affiliates in Florida, so ours will be the one on the west coast.
So some are going to merge together.
Yeah. So, and I was talking that our affiliate right now goes up to 16 weeks. The affiliate that we're about to merge with, Orlando, goes up to 22.6. about 1,000.
In a given week, how many 16-weekers do you think you do?
Probably like one.
Oh, okay.
Yeah, not many. Not enough to make it worthwhile. But Orlando, I mean, I think next week they're doing like 18 second try procedures. So
Oh wow, that's definitely worth it.
18 and above. So they're all cervical preps. So that's who you should be talking to.
Do you know when they start to ditch? What age do they use to do this?
I think she did this at all.
They don't use ditch at all.
No,
And they go up to 22.
Yeah.
Because self-viability is like the most important thing. You know what I mean?
Yeah. No, I don't think she does ditch at all. Cause she trained like I did, which is like not
Just-
ditch.
right.
Just document and you're fine.
Okay.
So
Can you explain to me about the documentation? Because people have talked about that before, and because it's an issue.
So there's the reason people do Dachshund at all is for one or two reasons. One is to comply with the partial birth abortion ban.
Okay.
So that's why. Or that they think that the Dachshund makes the procedure easier. So some people train to just document that, like, to comply with the partial birth abortion ban, you basically have to say, I intend to utilize dismemberment techniques for this procedure, which is what we do always.
Right.
If you do a procedure with suction, that's how you do it.
Right.
So if you document that, then you can some people just don't do DID because that's how they comply with the ban.
Right.
Absolutely.
So it's just like an affidavit that they sign, or what is
It's
it?
not an affidavit, it's just clinical documentation. That this was your intent, that's how you did the procedure, and then you're done. And
This
you
is
don't
the
do
standard
DID.
form that the provider signs every time, or what's it like?
It's in each, so every time you do a procedure, that's how you document. So like there's like a checkbox that says, I intend to, so before the procedure, do your evaluation, you write, I intend to utilize dismemberment techniques for this procedure. So
Does it
that's
actually say dismemberment?
It does, yes, because that's how you comply.
I mean, that's compliance, right?
And then when you
The
document,
stigma is everywhere, right?
well, that's just how you document. Whatever. So, and then when you document, if you use forceps, you say that you use forceps and extract, or you say that you use suction, in which case you can't suction the entire pregnancy in one.
course.
So that's how so you either use suction or you document that if you use suction or use forceps that you extracted the fetus in one. And that's how you comply. Or you do DID and stop the cardiac activity before the procedure. So I train to just do the documentation and not do the
And
And I think that Mary also does it that way.
And how far do you go up to 16 weeks?
Our affiliate goes to 16, but the affiliate we're about to merge with, which is Orlando, goes up to 22.
And so if you have that documentation, you can convert to breech beforehand and all of that. And so,
You don't really convert to breech. I mean, you just do the procedure. Like, it's not, and this is the thing. Like, so, I trained with somebody who just was like, I'm not doing the Dachshund.
Right.
And we're just going to document, and there's never been a problem.
Okay.
So that's just how we do it. So that's just how I learn. So that's, I don't think Mary does it until like 90. Yeah, she doesn't. I don't think she does. So that's just it's just a training thing and like what you're comfortable with. And some people say that DID makes the procedure easier. So if you haven't trained with it, that's what you're used to.
Okay. So it's just like a familiarity and like what you know.
It's just like, I don't know. I've never done a procedure with DID, so I don't know. Maybe it's like 20 times easier, but that's just never what
No,
I've
I see.
done. So.
Here, let me give you these.
Okay.
This is his card, and then this is mine. Like, I'm the
Okay.
tech. Do you have one that we can get from you?
You know what? I didn't bring my card. It's not really smart. But how did you see to Mary? Or
Yeah, we can
ask her
send her that way.
here. So what do you guys do? So you take the tissue and then what do you do
We would send a
with it?
technician out to your site.
Okay.
They would kind of set up in the path lab. They just need a little
In
space.
Florida, right?
Yeah,
Like in
to
Orlando.
receive
Absolutely. No, yeah.
specimens, and then they do their dissections, package it up, ship it off to the researcher.
Okay.
It's very simple.
Yeah.
Okay.
It sounds complicated, but it's really very simple.
Yeah, so like in my
Okay.
instance, as I was telling you, like I go in there, I do the consenting, I act as a floater, and then do my thing and just get out of your hair. Super.
Okay.
Try to be as easy and discreet as possible.
Okay. So you talk with the patients about donating tissue.
Absolutely, yes.
Okay.
And then Susan Tenenbaum, she's our founder and CEO.
Okay.
Excuse me. Yeah. So, relatively painless for the most part.
Okay.
But I do.
Yeah, no, but patients ask us about it. And so the other question I have is like, is it legal in Florida? I think it's probably fine. you want to check.
I assume it's governed under the anatomic gift, the standard anatomic gift law, which is standard.
Okay.
Yeah,
Federal and
That's what we
state.
offer it under, yeah.
Okay. Okay. That's the only other thing.
Standard for donation, yeah.
All right. Well, I'll tell Mary, and she should come and talk to you. Because I think it's definitely, again, patient act. So it would be nice to be able to say, yes, you can do that if you want to.
Thank you. I'm really glad I ran into you. Like, thank you so much.
Do you have any pulse on kind of what the affiliate would expect in terms of compensation or anything like that?
I'm the medical director, so probably better to talk to CEOs. But that's what I was going to ask is what happened, like how does that work even, or so I probably would need to like bring back
started
something.
like $100 per specimen. Actually, the doctor.
Yeah, as far as remuneration goes, we propose like $100 a specimen
Okay.
per specimen, and just to return a portion of our funds to the research.
Yeah.
That's what we talk about. That's what we propose,
Okay.
but definitely open to whatever works best.
Okay.
Because just talking here, with some of the directors, it's just like it's necessary. Some of the clinics, especially the independent ones, do find that necessary and helpful to be remunerated for it.
Yeah.
So we're definitely open.
Okay.
One of the competitive edges, like I said, we have is to operate dropship. So it can be expensive, but it does save costs by not opening up facilities every single state. You see?
Yeah.
Oh, yeah.
Okay. Well, yeah. So that's helpful for me to have some idea, so I can talk to our CEO. And, the reality is right now, like that tissue is going to Stericycle, so
Right.
it's not like no good is coming of it really.
Absolutely.
So so let me talk to her and I'll get her to. But either way, I'm about to be the medical director of that affiliate in addition to ours. So on some level, it's gonna be
Congratulations.
So,
That's kind of a big thing.
it's great. It's good. It's a lot of extra work.
It's heavy, I
It's all
bet.
good, but it's all good.
Well, cheers to you,
It's good
Suzie.
for our thanks. It's good to meet you, and
You as well.
we'll be in touch.
Absolutely. See you soon.